Good morning, Ralph Dwayne. I am Mihiraa. Let's start the warm-up sessions. Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
I find the best way to handle the stress of being a nurse is through meticulous organization and attention to detail, by making lists and prioritizing what needs to get done throughout my day. I find that tasks that might seem overwhelming all at once are much more manageable. This also makes it possible for me to stay calm and remain focused on what needs to be done when unexpected situations arise.
Your preparation time is over. You can now start the role play.
Thank you, Mihiraa, for allowing me to examine your condition. Let's discuss this a bit more so I can get a better understanding. Could you please explain in detail about your condition?
Sure, I first noticed it about a week ago. It was small at first, but it started getting bigger and more painful over the last few days. I tried to leave it alone, but yesterday I squeezed it because it looked like it had pus.
I see. How often have you been experiencing symptoms like pain or swelling?
The pain and swelling started to increase about 3 days ago.
I understand. Have you tried any treatments at home, such as applying any ointments or taking any medications?
I applied some over-the-counter antibiotic cream, but it didn't seem to help much.
Based on what you've described in my examination, it's clear that the pustule is infected. I can see redness and swelling, and you've mentioned experiencing pain, all of which are common signs of infection. I understand that you may have tried to alleviate the discomfort by squeezing it, but unfortunately, that might have made things worse. Squeezing it might have exacerbated the condition. Given the infection, I would recommend scheduling an appointment with the doctor. Mihiraa, it's important that you see a doctor because the doctor can conduct a more thorough examination and determine the best course of action, which may include prescribing antibiotics to help clear up the infection. Your well-being is our priority, and we want to make sure you receive the care and attention you need. Do you have any concerns or questions?
Do I really need to see a doctor? Can't I just continue with the wound dressing?
I understand your hesitation about seeing a doctor and wanting to continue with just the wound dressing. However, it's important to see a doctor for a few reasons. First, the doctor can rule out any underlying problems or causes of the infection that we might not be aware of. They can also create a treatment plan specifically tailored to your condition, which might include antibiotics that are more effective than over-the-counter options. Moreover, Mihiraa, if the infection is left untreated, there are several risks. The infection could worsen and lead to abscesses, which are painful collections of pus that might require surgical drainage. In more severe cases, the infection could spread to other parts of your body and potentially lead to sepsis, a serious condition that can be life-threatening. By seeing a doctor, we can prevent these complications and ensure you get the right treatment to heal properly. Your health and well-being are our top priorities, and we want to make sure you're on the best path to recovery.
That sounds serious. I didn't realize it could get that bad.
Yes, Mihiraa, it's important to take this seriously, and I'm glad we can discuss it now to prevent any complications. There are some important steps you can take to care for the wound and help it heal. First, keep the wound dry and clean. Gently wash the area with mild soap and water, and then cover it with a sterile bandage. Avoid squeezing or picking at the pustule, as this can make the infection worse. It's also important to know when to seek medical attention. If you notice increased redness, swelling, or pain, or if you develop a fever, please contact us immediately. These can be signs that the infection is getting worse, and prompt medical attention can help prevent further complications. Mihiraa, taking these precautions will help ensure you recover quickly and safely. If you have any questions or concerns, please don't hesitate to reach out.
All right, I understand.
Great. Given the seriousness of the situation, Mihiraa, it's important to take the necessary steps to ensure proper treatment. Can I go ahead and help you schedule an appointment with the doctor? This will allow us to address the infection thoroughly and prevent any complications. Is that okay with you?
Yes, that would be great. Thank you for your help, nurse.
You're welcome, Mihiraa. I'll arrange the appointment for you now.